Did you know that up to 80% of disease symptoms are triggered by problems that start in your mouth? Many health problems like heart disease, dementia, Alzheimer's, autoimmune disorders, and even some cancers have their roots in poor oral health. Science clearly reveals that bacteria and gum disease can raise your risk of hypertension, cardiovascular disease, fatal heart attack, and even stroke. You may be thinking, I'm fine. I brush and floss every day. I go to the dentist, but here's the kicker. You can still have chronic disease and toxicity in your mouth that's slowly poisoning the rest of your body and not even know it, because disease in your mouth is silent. This is not a subject that gets discussed enough, in my opinion, but we're finally making the connection of how your mouth affects the rest of your body. This is why you're going to start hearing more and more about it. What I learned from having cancer is that our healthcare system is a business that needs customers, and it's designed to treat symptoms so they can sell you their solution, which is drugs. Those drugs keep the symptoms from returning or mask them rather than treating the root cause or even trying to find the root cause. I learned that I couldn't take a lot of those drugs without side effects. So I had to find an alternative of how I could keep cancer from coming back and not have to take these drugs for 5 years of my life so I could get out of bed and function. The Center for Disease Control and Prevention, CDC, recently did a study. A total of 64.7 million people have some form of gum disease, either mild, moderate, or severe. In adults 65 or older, the rate of gum disease rises to 70%. That's a lot of people. When you include gingivitis, which is inflammation of the gums, over 80% of the US population suffer from some form of dental disease, cavities, gingivitis, periodontal disease, making it one of the most common diseases. Again, common doesn't mean normal. It doesn't mean you have to have it, but you do need to be aware and know what to look for and know if you're at risk for it so you can prevent it or stop it. 73% of children under the age of 6 are affected with gingivitis and have at least one cavity. Gingivitis is the prime cause of inflammation in the mouth and the body in response to dental plaque accumulating along the gum line. This inflammation affects the surrounding tissue and teeth. Gingivitis is a precursor, often marked by red, swollen gums and slight bleeding when you brush and floss or when your child brushes and flosses. And when we have bleeding gums, we don't think much about it. If we had bleeding anywhere else in our body, we would want to stop it. We would put a Band-Aid on it. But in our mouth, we don't think much about it, usually because it stops and it's just a short period. And dental cavities is the most common chronic disease in children, 5 times more common than asthma and 7 times more common than hay fever. Again, common doesn't mean normal. It doesn't mean our kids have to get dental disease. Dental disease is preventable, but you need to know what it is and how you get it. And the argument that most parents give me is, well, they're going to fall out anyway. True, they will lose those baby teeth eventually, but losing them early can create problems. And you need them till you're about 12 or 13. Sometimes 14 or 15 in my daughter's case. And when you get cavities, it's possible that the adult teeth will not come in the correct spot, or they'll have crowding because they lose the space. The baby tooth holds the space for the adult tooth and guides that adult tooth into the place of where it needs to go. Children with poor oral health miss more school, have lower grades, don't have the ability to focus. Children miss more than 51 million school hours per year due to illnesses related to dental problems. They also have difficulty focusing when they're experiencing a toothache or just having problems breathing that we don't even look at, that we can see when they're just sitting in front of us with their mouth open. If they have dark circles under their eyes, if they have forward head posture, rolled shoulders, we can see that they're going to be at risk for some airway problems. So not only dental problems, but other medical problems. And this has become a national crisis. Oral health is part of overall healthcare. Oral health education is really lacking, especially early in a child's life. We have a great opportunity to begin this oral health discussion even before kids are born. There's evidence that the mom's oral health status can affect their child's health. We can pass that bacteria from mom to child. The risk of an infant getting cavities goes hand in hand with the mom's oral bacteria in her mouth, or even the dad being transmitted to the infant, especially if you put the pacifier in the mouth and then put the pacifier in your child's mouth. Babies are actually born with no harmful bacteria in their mouth. There are also no quick fixes for dental disease. You don't get it overnight, and you can't cure it overnight. But you do have the power to perform good habits that protect your oral health, your children's oral health, and your family in the long run. There are health risks for having gingivitis. And when you have gingivitis and you're pregnant, you have low birth weight, but you have to understand what it is and know that you have it in the first place. And the bacteria in your mouth love to feed on sugar. So you get a biofilm that builds up in your mouth from the saliva, much like the bottom of a boat. But in your mouth, when you eat, you feed that bacteria sugar. And then when that bacteria poop, they poop an acid. This dental biofilm can get into the cardiovascular system when you brush your teeth. It can also get into the arteries of the heart, making it harder for the heart to pump blood through the arteries because it starts to constrict it after a while. You can also inhale this bacteria into your lungs, which is why a lot of the elderly population in nursing homes have aspiration pneumonia. It's not science fiction. There are tons of scientific studies that show what happens with the bacteria in your mouth, gum disease, cavities, and how it increases your risk of dementia, Alzheimer's, heart disease, stroke, and how it's connected to diabetes. Gum disease is directly related to a lot of other conditions in the body. We know we need to brush twice a day and floss once a day. Brushing and flossing are just a small piece of the puzzle. There's also diet, pH, how much water we drink, oxygen, sleeping, and breathing. We need to put all of these puzzle pieces together to truly be healthy. We only get one body and you are the owner. And that's where I came up with oxygen, water, nutrition, enough sleep, and respecting the one body you have. Owner, you get to make these choices. You get to decide if you're going to be healthy or not. We are set up to fail with our food supply the way that it is, with the fact that we don't look at our breathing, with our healthcare system being a sick care system and only really treating symptoms and not getting to the root cause. A lot of times when you have things going on in your body, it means that there's something else happening. If you're snoring, clenching, grinding, that's usually your body's way of compensating for getting your tongue out of the airway. That's why myofunctional therapy is starting to become more popular. I've worked in that part of the body for over 30 years, and I had no idea that my daughter's bedwetting was connected to her mouth breathing and that her ADHD symptoms were identical to sleep disordered breathing. I was shocked to find that out. And this is why I want you guys to know what to look for and figure out, are you at risk? Is your child at risk? Because there's a whole segment of kids from the ages 2 to 8 that we can do things for that maybe would make it so they don't need braces, so they'll be able to breathe, so they can focus in school. Because when you're a mouth breather as a child, you get 18% less oxygen to your brain. While you're growing and developing, you have less oxygen. You're not sleeping as well. You're not resting and restoring. Think about how that's affecting your child. Your doctor, your dentist may not just be skipping over this. It just might not be something that they learned. So unless you went down a rabbit hole to learn why these things are happening because you're trying to help your child, you might not even know this. You might not know to look for it. So you definitely won't know how to stop it or change what's happening in there for the better or even prevent it. So this is where knowledge is power. And if our child can't breathe or they're sleeping with their mouth open, pediatric sleep breathing disorder can turn your child's night from peaceful dream to fighting for their life to try to get oxygen. Fight or flight can leave them exhausted during the day with little energy for learning. And long-term being in fight or flight at night when you sleep can have major disruption in their growth and development. All of these disorders are treatable, and there are many options that can give your kids a better night's sleep as they grow into their childhood. Pediatric sleep breathing disorder and ADHD have common symptoms. So much so, sometimes it's hard to tell them apart, and kids are getting misdiagnosed. With pediatric sleep disordered breathing, a child is unable to breathe easily at night, preventing them to get the oxygen that they need. More than 25% of all children suffer from some form of pediatric sleep disorder breathing. 5% of them have some form of sleep apnea. The types of pediatric breathing disorders will differ from child to child. What can you look for? What are the symptoms? What are the signs that you want to look for? Snoring, bedwetting, night terrors, sleep terrors, poor performance at school, low energy, lack of focus, learning challenges, behavior challenges, failure to grow, unhealthy weight gain, or hyperactivity, being diagnosed with ADHD. These are all things that you're going to want to look for. There are sleep studies that you can do. Some doctors or dentists recommend a sleep study, some don't, because unless it's actually sleep apnea where they stop breathing, a lot of times these kids go undetected. They're under the radar. They're saying that there's no problem, but it's still kicking you out of the cycles of sleep and they're not getting good REM sleep. So if your child is diagnosed with a sleep breathing disorder or ADHD, they might benefit from myofunctional therapy, an oral appliance to widen their arch, orthodontics, chiropractors, a body worker. Sometimes you do need to go on medication, but it's good to look into, can they breathe first? Or you might need your adenoids removed or your tonsils removed, some type of surgery. Sometimes just nasal hygiene and clearing out the nose can help. These are things that can create a serious risk, especially if they go unnoticed with your child. They grow into sleep apnea as an adult. Myofunctional therapy are exercises that establish positive habits with your tongue and the other muscles of your face, learning to use your tongue separately from your neck and your chin. Because the most common obstruction is your tongue, especially if it's tethered and it doesn't have good range of motion. A lot of times it's what's blocking the airway. You can take a video of your child about 90 minutes after they fall asleep and see, are they breathing with their mouth open? Are they making some of these noises? Are they snoring? Are they grinding their teeth? Are they tossing and turning? Do they end up upside down? Are there sheets all over? Do they wake up tired? Do they wake up with dark circles under the eyes? Do they walk on their tiptoes? Do they have night terrors? Do they sleepwalk? These are all things that could be an airway problem that is affecting their sleeping. We really believe that getting good sleep is essential. Oxygen is the number one element we need to survive and thrive. If we're breathing through our mouth, we're not getting enough oxygen. Don't wait till your child is suffering. If you see these things, get help. There's a narrow window to be able to reverse these diseases if you see them sooner as they grow, and it can prevent other things. Because I was told that my daughter would outgrow bedwetting. She didn't outgrow bedwetting. She grew into different problems. So she might have stopped bedwetting, but there were other issues. So it wasn't until we addressed her tongue and her breathing that helped. Sleep apnea, sleep disorder breathing, ADHD. Look at these symptoms, ask better questions. When we know better, we can do better. I wish I knew these things when my daughter was little. This is why I share this information and my story, so you can save time, money, heartache, watching your child go through something that was preventable. If I had only known, right? Our modern medical system is not designed to help us get and stay healthy. It is a sick care system that is designed to eliminate symptoms. Doctors do what they were taught in school. Their job is not to make people healthy. Their job is to figure out what the symptoms are and treat the symptoms by selling drugs. It's a perpetual system. We need to be able to breathe in order to survive and thrive. So this is where we should start when we're talking about being healthy. In my opinion, breathing is where we should start first. Just because we can breathe through our mouth doesn't mean we should. If you truly want to be healthy, we need to breathe through our nose. I think I stressed that enough, right? I had a problem and I had to find out the hard way how to heal my body. What I've learned through all this, through going through cancer, for using the healthcare system, is that I created the environment in my body that helped the cancer grow. So I could uncreate that environment by changing my habits, by making better choices. But it's a process. It's not easy. And it's a learning curve. You have to learn what's going on in your body. You have to be a detective. And if you're at risk, you really need to look at all of these signs and symptoms, starting with how do you breathe? Your body gives you warning signs. Please listen for yourself and your children before your body gives you a wake-up call and forces you to change. That's what happened to me. I ignored a lot of these symptoms, or I was told that it was just stress. It was because of what I was going through. It was a little more than stress. And I also know that there are tests you can do to see if you have cancer, to find out if things are off in your body. Do you have heavy metals? My friend, Dr. Kelly Shockley and Melissa Deely, they test what are the toxic levels in your body, what is out of balance in your body before you show symptoms. Or if you have symptoms, what can we do? A lot of these things are not genetic, they're epigenetic, which offers us different options to treating them. If you do a lot of these tests earlier, there are different treatment approaches that you can do. Epigenetic changes are triggered by environmental changes. So they can be reversed by changing the environmental conditions again. So you can keep changing your environment to get your desired results. I wish I knew that there were cancer markers that I could have had tests when I was in my 20s or 30s. I would have had those cancer markers done every year to see what was happening in my body and do what I needed to balance. So I could stimulate the good cells going instead of the cancer cells growing. Sugar feeds cancer. Sugar's in everything. And I have a donut addiction. So I was feeding the cancer all the time. And there's so many different names of sugars, probably over 80. So we don't even know what's in our foods. So we really need to stay shopping in the perimeter of the grocery store. When we go up and down those aisles with all those processed foods, that's what's making us sick. I'm not usually a conspiracy theorist, but having cancer and looking at everything, the products we use, the foods that we use, how our healthcare system works, it's set up for us to fail. It's stacked against us. It's stacked for us to get sick. Share this information, learn more, ask better questions, find doctors that are going to help you, that know this information, that are going to help you get healthy, that are going to help you stay healthy, that are going to help you prevent these things rather than waiting until there's a problem. It's a capitalist world. People don't want to pay for prevention. They want to pay for you to solve a problem because people have lots of problems, right? But you're going to pay a lot more to solve a problem because you really want it solved now. Wouldn't it make more sense to make better choices before you've needed to solve a problem? Right now, sleep disorder, breathing, they are prominent, and they're problems that a lot of people are having and they don't even realize it. But then you have to find a doctor that's trained for sleep disorder breathing, not just give you a CPAP machine or a night guard or a pill and tell you that you're fine or tell you that your child will outgrow it, because they won't. They're going to grow into bigger problems. So if you or a loved one is suffering from this, click below and schedule a 15-minute call and we'll figure out what's going on. If I can't help you, I'll send you to someone that can. It all starts with your head. What do you believe? How are you breathing? What are you putting in your mouth? It's all connected. Consequences happen with the choices that we make, whether we know it or not. So a healthy mouth is a healthy body and a happy, healthy life. As always, thanks for watching. And if this was helpful, please share. Till next time.